Now, there are growing calls for rotational learning at schools to come to an end. The Basic Education Department made a recommendation to the National Coronavirus Command Council to reduce the social distancing measures in classrooms and allow all children to return to school to mitigate against dropouts and increase retention rates. But the question is, are we as a country ready for full classrooms, and how will this impact on the country's response to COVID-19? Joining me now to talk about this, Virologist, Professor Schoub, and Equal Education's Head of Research, Roné McFarlane. Good evening, and thank you very much for your time and joining us tonight here on In Focus. Roné, let me start with you. 26,000 schools or so we have in the country. According to the South African Human Rights Commission, 3,000 of them are still using pit toilets. Now, they are unsafe classrooms, unsafe toilets without a pandemic. Now we do have a pandemic, but we want those children to go back to school in full. Will the schools be able to handle that?
Yes, I think, as a country for the past 2 years, we have really faced an incredibly difficult and in many ways tragic conundrum, in that we were so aware of the incredible impact that school closures have on learners. We know that many learners can't really learn from home. The remote learning setup hasn't worked for the majority of our learners, and so huge amounts of learning time have been lost. We know that learners access important services at schools, including 9 million learners who access a daily meal at school. Learners have access to psychosocial support at school, and obviously also the benefits of socializing with friends that come from being at school. And all of that was disrupted as a result of the school closures related to COVID. Yeah. On top of that, we saw increases in teenage pregnancies and in learners being vulnerable to violence when they are often, left at home when parents have to work and that type of situation. At the same time, obviously, one was aware of the tremendous risks related to the pandemic and the fear around that spreading at schools and then going into communities and also causing harm there. So it is incredibly unfortunate that our schooling system wasn't able to better accommodate learners, to accommodate safe learning. Even when we were a little bit more comfortable with returning to some activities, our schools weren't able to allow for social distancing because overcrowding is a problem. And as you say, sanitation is also a huge problem. Yeah. The reality, though, is two things. And I'm sure we will talk about that more tonight. The one thing is obviously that we are at a different point in the pandemic. There are certain measures that have become available. Vaccines have been widely made available to teachers. Learners can also, who are over the age of 12, who are likely to be at higher risk, can get access to vaccines now as well. So those are important things that are in place. The other important thing to say is that overcrowding and sanitation shortages are a real systemic problem that we have to deal with. But the rotational timetables was an emergency measure to deal with that. And we can't continue indefinitely with an emergency measure. We now have to deal with those systemic problems. Yes.
Prof, let's bring you in then on that particular note. We are now at a different point in our management of the COVID-19 pandemic with maybe nearly close to 40% of the population now vaccinated, including some 12 to 17-year-olds which are vaccinated. You let us in on the actual extent of how many of them have been vaccinated and whether or not weighing the basket of issues that come with not having all of them at school, socialization, difficulty in learning, difficulty in connecting online and so on and so forth. Does that, in a sense, when you weigh the two, at least make a case for them to go back to school?
Yes, good evening, Tava. Yeah, I think Roné has actually articulated it very well. I'm not sure I can really add too much. As she said, there's been an incredible amount of damage which has been done over the past couple of years because of the COVID pandemic, because of the public health need to have school closure. But I think we're now at the stage, really, we're going to our third year. The epidemic we're coming out of our fourth wave, the Omicron-driven wave. We do have measures which can be put into place, particularly vaccination. And I think it really is time that we abolish the school closures, certainly at the moment. Obviously, we need to keep a wary eye out. If there's an uptick, if there's an early fifth wave, we'll probably only get another fifth wave in about 3 months' time. And at this stage, the signs look reasonably promising for it to be not as severe as our previous waves. But of course, this is guesswork, this is speculation.
Yeah.
But certainly at the moment, the damage has been done, and I think we need to kind of stop that damage. I think the children need to get back to school. One caution note I would like to kind of make is that it's not to say that the epidemic has gone. We are still getting, 2, 3, 4,000 new cases per day. So I think we still need to be cognizant of that in terms of precautions that we take. The schools could also be a vehicle for propagating vaccination, both for learners and both for educators. There are still quite significant gaps, particularly for the teenagers, the 12 to 17-year-old. We're less than 20% of that population being covered. And also adults as well. There's a big gap of vaccination that has to be kind of achieved in that age group as well. So I think schools would afford, in fact, a possibility and an opportunity to, in fact, look at those possible ways of addressing from a public health point of view.
Yeah. From a public health point of view, would they still, Prof, require to be a degree of social distancing?
I think ideally, yes. But, we have to be realistic about it. Ideally, and this is what we'd like to kind of see, that children are masked, that they do wear masks. We do need to take into account that it's very difficult for the very young children to keep masks on. We do need to have sanitizers available. We do need to keep distance between children. We do need to be particularly vigilant when they are eating, when the masks come down. I think all these measures, I think people just need to be aware of and cognizant of, because the virus is there, the epidemic is there. But, I think we need to temper that with a bit of realism as well. But it's a matter of education, it's a matter of communication.
Let's take a break. We'll continue in a moment. Professor Barry Schoub, Virologist and Equal Education Head of Research at Roné McFarlane on this conversation. And we'll ask Roné in particular, how successful have we been in implementing the current measures that are in place, making sure that, for example, learners put on their masks, have we supplied enough masks, have we supplied enough sanitizers in schools, and what will we make of the questions around the distances, particularly in schools where overcrowding is, of course, a reality, considering a number of kids who are still not placed, particularly even at this time, with various challenges in our education system. Do stay with us. In Focus continues in a moment. Welcome back. Is it time to return to full-time learning, as many quarters of society have been calling for? Prof. Barry Schoub with us tonight, as well as Roné McFarlane. Roné, one would say, I suppose, in the 18 or so, close to 24 months now that we've been living with this virus, we have acquired a degree of know-how, I suppose, from the educators themselves in handling the situation. But do we have the resources to be able to go back to full-time learning and to be able to successfully be compliant with any regulations that would be put in place, or do we need to completely lift these regulations and just go to normal learning?
Yeah, it is a real question that the DBE is currently considering and hopefully will move on quite soon. They had originally, the initial requirement was that learners needed to be at least 1.5 meters apart from each other. And if schools couldn't safely accommodate learners with that distance between each other, then they had to implement a rotational timetable And just to make sure we're all aware of what that means, it basically means that learners aren't attending school every day. Some cases they're attending school 2 to 3 times a day, and in some cases our members have told us that they're attending up to 1 day a week. So you can just imagine the tremendous disruption to education that resulted from that. So then the department actually amended their directions to say that, if you can keep learners 1 meter apart, or if you can allow for social distancing of 1 meter, then you can return full time. But even the 1 meter rule, still some academics estimate about 70% of schools in certain provinces have still applied to continue rotational timetables because they simply don't have the space to accommodate that type of distance between learners and have learners attend every day. So the reality is that we will probably not be able to go back to full-time learning without significantly reducing that requirement of the distance between learners, and trying to focus on other measures, like, for instance, importantly, keeping windows open to secure ventilation, masking, sanitizing, and so forth. And then obviously also encouraging uptake of vaccines in schools. Given that learners can now be vaccinated, schools could be a really good place for learners to get easy access to those vaccines. So that's definitely something to consider. But the reality that we are faced with is that as long as there is the 1 meter social distancing rule, the majority of our schools simply cannot accommodate that and cannot return to full-time schooling.
Yeah. Prof, if we do indeed reduce that 1 meter social distancing regulation that's in place, is that a risk that could potentially turn the schools into super spreader nodes within the various parts of South Africa? And you mentioned that if, I don't know how big the if is, but you said if there is another outbreak, could that certainly be bringing complications for our handling and our management of the COVID-19 pandemic?
Yeah, Tabe, I think we've learned quite a lot about this pandemic over these couple. When we started off, we were under the impression that the virus was spread by only by droplets. In other words, by large particles which kind of fall down to the earth, and therefore that kind of originally 2 meters, in fact, then 1.6 meters, then 1 meter rule kind of came into place. But now we know that the virus is actually spread by aerosols as well. Aerosols are finer particles which remain suspended in the air for quite a period of time. So I don't think that that distance is going to be a make or break. Obviously, where we can, it would be ideal, as I mentioned, but it's not really a make or break. And when it's not feasible, where it's not practical, then we just simply can't. I think wearing masks is certainly important. And I think we do need to try and ensure, particularly the older kids, maybe it might be a bit difficult for preschool children, but certainly children from primary school upwards, we need to try and wear masks. As Roné pointed out, ventilation is extremely important. It becomes a problem in winter, of course, but we do need to kind of keep the doors open, the windows open, see there's good ventilation. Sanitizing of hands is probably also important. And vaccination. Vaccination, we try and get, at least with the teenage, the 12 to 17-year-old, as I say, we're about less than 20% of that population vaccinated. We need to kind of up that considerably, and I think that would make a major difference.
Yeah. What is that dependent on? Is it mostly the parents are not taking the learners? I mean, I suppose if they are 12 to 17, they would still need to be encouraged quite a great deal by their parents to have the vaccines administered. But of course, if we turn the schools themselves into centers probably for vaccination, what would the implications be there, and parents having a buy-in into that?
Yeah, I think, again, it's a matter of communication. We need to kind of have good, trusted communicators that are trusted by the community themselves, to kind of give the the proper information, the evidence-based information, the scientific information about vaccines. Unfortunately, there is a lot of mistruths, a lot of misinformation. There's a lot of also, I guess to some extent, apathy, and also a lot of mistrust, and that needs to be overcome. But certainly the kind of having the school as a facility for vaccination would be a great step forward. Roné can kind of comment on this. I'm not quite sure what the attitude of the Department of Basic Education is to using schools as vaccination sites, but that certainly would be a great step forward.
Yeah. As far as the third concern, the role of the children in schools and spreading the virus beyond the school premises, is the debate now settled? Because there was the whole debate around they'll go to school, they'll go home, they have elders with comorbidities, and so on and so forth, and they'll be spreading this to the communities.
Yeah, I think this is the worry. This is the risk, that we do establish what we call chains of transmission, because children generally tolerate the virus pretty well. They usually are either asymptomatic without any symptoms, or they're very mild, but they can then pass it on to others who can pass it on to others, and eventually it can land up with somebody that is vulnerable, an elderly grandparent or somebody with comorbidities. And I think this is what we need to guard against, because many people say, well, if children get it, it's not so serious. Well, first of all, it can be in rare situations, but also we worry about, as I say, these chains of transmission, which can transmit it to somebody that is vulnerable.
Yeah. Is this the right time, Prof, finally, and I'll go back to you, Roné, and get your views, to implement this return or this cancellation of rotational learning, considering that you've already mentioned that we are more than likely to have another spike around 3 or 4 months down the line?
Yeah, I think from a epidemiological point of view, of a public health view, it looks to find balance. It's a balance between the public health need, which at the moment has kind of reduced quite considerably, particularly where we are at the moment. The epidemic is at a pretty low level now. The Omicron we know the Omicron produced very much milder illness. So I think it is now time where we can actually look at that balance and look at the need and the critical need, as Roné has pointed out, the critical need for children to return to classroom education. And of course, there are other health, non-COVID health issues we need to look at as well. There's feeding in schools, and there's looking after other health needs, which to some extent have been compromised by the COVID pandemic. So I think at the moment it is time to reevaluate the other needs, both educational needs, child development needs, mental needs, and other health needs, and balance it against our COVID public health needs. So yes, I do think it is time now that children do return to schools.
Yeah. The attitude of educators there, Roné, around that issue of the third concern of children being spreaders of the virus beyond the school premises. There were concerns around teachers as well in their interaction with the children, particularly earlier on. We lost a number of teachers in our schools to COVID. And then the question that I just put now on the timing of it. There's a chance that if there is another outbreak, kids would need to be once again be taken out of school, and the instability that this will create.
Yes, well, I mean, obviously the rotational timetable approach is causing tremendous instability when you have learners not attending on the same days. Some days they're attending, some weeks they're attending 2 days, some days they're attending 3 days. So it's already causing a lot of instability. And the thing that Equal Education has been calling for with regards to school closures, and that we have to think about in terms of rotational timetabling as well, is that we have to follow a risk-adjusted approach, which means that we don't have standard closures and standard rotation regardless of what's happening, how the virus is, spreading differently in different parts of the country, and also at different times of the year. So just saying that we have to go back to full-time schooling now doesn't mean that we can never again go back to rotational timetabling. Of course, we need to we need to follow the developments of the pandemic. I mean, it's shown itself to be incredibly unpredictable, so we don't know what happens in the future. We're not saying we must take this approach completely off the table forever, but we are at a particular moment where infection rates are lower than they've been in the past, where we are seeing the virus acting a bit differently than it did in the past, and where we have vaccines. And it seems like the ideal moment to go back to school for a period. Maybe, as you say, there comes another another wave, and we have to respond to that again. But we can't indefinitely keep schools closed in anticipation of that wave. When that wave comes, we need to deal with that again. Because even though that's not ideal, even though we want to keep schools open as far as possible, it's still better than constantly rotating for the entire year.
Roné, I appreciate your time, and Prof. Schoub, thank you very much for coming on. That's where we leave it for tonight.